The most important thing that you as a diabetic patient can do is to learn as much as possible about the disease. Why is the disease in the family? How do you treat it? What is the best way to address the complications, the immediate, complications that you have during the highs and low blood sugars, and also those that chronic complications. So as you learn those, you'll be more at a situation where you can actually discuss directly with your doctor, with your nurse, what's the best treatment, what's the best way to address the treatment of diabetes. And this is also important for preventing complications, for preventing the problems that are associated with diabetes over time. And I think this is the single most important advice that I give to you, is just learn about the disease, because when you make a change to your insulin regimen, when you change any other medication, when you change your diet, when you start exercising more or less, when you gain or lose weight, anything will change the way your diabetes responds to the therapy, to the treatment. You should discuss it with your doctors and with your nurses, because you have enough knowledge to understand what they're going to do about your diabetes. When I recommend to you to get involved, to get to know your disease, I also mean to ask you to discuss with your doctor and with your nurse what's the best way to treat your diabetes. Because obviously, as you know, there are several ways. You can treat your diabetes with oral agents, medications, pills, and you can treat it with a series of different insulin regimens, ways of insulins that can be injected. And you can use pumps, you can use 3 injections a day, you can use 2 injections a day. These are different regimens that you can get involved, and therefore, whatever suits your lifestyle. If you eat 3 times a day, you might want to, prefer the injections before those meals. If one of them is outside the house, if it's in the streets, you might want to avoid to inject yourself in the street, and you want to prefer, to take the injections at home. If you have your hands free and you're interested in checking sugars often and you want to get a little bit more aggressive, you can use an insulin pump. There are several ways by which your knowledge of diabetes can help your doctor and your nurse decide how you're going to treat and what's the best lifestyle for you to adjust to the disease. Because diabetes is a disease for life. You have to adjust to it.